Okay, so this is my emergency kit. I chose the color red for the outside of my box. And then I chose a bright neon yellow to have a good contrast with the lettering so the emergency kit would stick out. And then I had to use my tape measure to keep my box closed. And inside are the essential items used in a medical emergency in the dental office. And I took a picture of each of them and I taped it with the name of it and the use and like where you would use it as far as in like orally or inhaled. So I'll just go ahead and start with the epinephrine or the EpiPen. It's used for an allergic reaction. My son had one because he used to be allergic to milk, and I was always told that if a child had like two symptoms, like a cough and the hives, or a rash started, or their tongue was swollen, that you would automatically like choose the EpiPen as your first go-to. But it also depends on, how many minutes does it take to the reaction to start. He used to have a reaction within 5 minutes to milk, and the EpiPen was a lifesaver. And then we have the diphenhydramine, and that's just Benadryl. It's like allergy medicine. It's also for an allergic reaction. And then we have the ammonia inhalants, and I just made that out of paper. And then I made my little ammonia inhalants. These batteries, and you just crush them, and the patient would inhale it. And it is used for a patient who has fainted. And then we have some cake icing. And that is used for a diabetic emergency, like a patient that has hypoglycemia, which is like blood sugar, and you would just use it orally and it will be absorbed rapidly into the bloodstream. So that's why you would use something like cake icing for a diabetic emergency. And then I have my albuterol inhaler, and that's used for a bronchospasm with asthma, and that's inhaled. Inhaler, you would take off the front, which is kind of like a barrier, and then you would mash the top. And most patients take like 2 puffs. My daughter has an inhaler. And then I have the aspirin. I just used beads, and I made the front of it. Aspirin is used for my myocardial infarction. And you would just take it orally. Our patient would take it orally. And then we have Tylenol, and I just use little straws. I made the Tylenol sign. Tylenol is used for pain relief, so you could use that for a few different things, like if the patient was just in pain with their tooth or something like that. And then we have the nitroglycerin lingual spray, and it's used for chest pain, and you just squirt it in their mouth, and normally it's not this big, it's something small, but this was the only thing I had that was like a squirt ball. Well, I can't get the lid off. And so that is my box. Decorated the inside, and again on each side there's the picture of how you would use it and what kind of medical emergency you would use it for.